Hi, my name is Dr. Raymond Benedetto, and I want to thank you for taking the time to watch this video today. Some of you may be watching on video, some of you may be watching on the internet or on YouTube, but I want to thank you for taking the time. We're going to be going over a lot of things today in a relatively short period of time, and we're talking all things peripheral neuropathy today. So either, I'm sure you may have it yourself, or you think you have it, you may have the symptoms of it, or a loved one has it. This can be a very informative video. Like I said, we're going to pack a lot of things into a relatively short period of time. So grab a pen, grab some paper, take some notes, and I'll give you my contact information and everything later. So if you have questions or concerns or anything like that, you'll be able to get in touch with us. Let's go ahead and dive right in. What we're going to be talking today is functional neurology and functional medicine for the treatment of peripheral neuropathy. Again, my name is Dr. Raymond Benedetto. I am a board-certified chiropractic neurologist. I'm practicing here in Bethlehem, Pennsylvania, a little over 10 years now, and I've been seeing lots of patients with peripheral neuropathy and helping get a lot of them better. So that may be you. Maybe you're one of those people. So we're going to go over everything today. Again, if you have any questions, you can get in touch with, we'll give you ways to get in touch with us. But we're going to go ahead and dive right in. All right, peripheral neuropathy. Some of the things we're going to talk about today. What is peripheral neuropathy? What causes it? What can be done to restore the health of the peripheral nerves? How can we get these damaged nerves better? Now, peripheral neuropathy in general, very common. I see a lot of patients with it. It's a chronic disease that affects over 20 million Americans. It's a lot of people. Okay, what happens is the wiring, the electric wiring, the nerves, is breaking down. It's being damaged. You can't feel, it's your feet and your hands primarily is where it starts. So patients will get these symptoms, numbness, tingling, burning in the feet or the hands. And basically, you know, if the nerves are being damaged, your feet and your hands can't communicate with your brain. And vice versa. The brain cannot communicate with your feet or your hands. Now, what does it mean? Peripheral neuropathy, that's a big fancy word. What does that mean? Peripheral means further out from the center of the body. So our central nervous system is our brain and our spinal cord. Peripheral nerves are everything else that branch off of there. Neuro means nerves. Pathy means abnormal. There's something abnormal going on with the nerves in the periphery. Now, 10 signs. These are the most common symptoms of peripheral neuropathy. Numbness, burning in your feet. You can get it in your hands also. Cramping, sharp electric type pains, pain when you walk, difficulty sleeping from discomfort, pricking and tingling feelings. A lot of times patients will describe it as a sock rolled up under their foot, the ball of their foot. Loss of balance, falling. It's obviously a dangerous complication. Weakness and swelling in their feet, typically the feet and or the hands. Now, the symptoms that you get depend on what type of nerve is being affected. There's different types of nerves. So the three main types of nerves are those that carry sensations, so sensory information, hot, cold, vibration, touch, all that stuff. Those that control the muscles, okay, that's motor function, right? So move the muscles. And those that carry information to the blood vessels in our body. Those are called autonomic nerves. Now, sensation changes. If we get damage to the sensory nerves, the sensory portion, it's going to result in changes of sensation, burning, nerve pain, tingling, numbness, inability to determine where your joints are, joint position sense. That can cause balance problems, right? If your brain doesn't know where your feet are because the nerves are damaged and there's no communication there, it can obviously set us up for some more severe balance problems, falling. Again, for many neuropathies, sensation changes begin with the feet, typically the furthest away from the heart, and progress to the center of the body as the condition worsens, or progress to the hands. Movement difficulties. So if we damage the motor part of the nerve that causes the movements, it interferes with the muscle control. It could cause things like weakness, atrophy. The muscles will shrink. We don't have the dexterity that we used to. We can't button shirts, things like that. Sometimes cramps, things like that, cramping and spasms in the muscle. Now, big picture-wise, all chronic conditions, peripheral neuropathy being one of them, share some common threads. Okay, peripheral neuropathy, diabetes, fibromyalgia, stenosis, all those kind of things. And again, peripheral neuropathy is up at the top of that list for sure because it's very common. There's two different causes usually. Okay, one of those would be metabolic causes, something's wrong with our metabolism, anemia. Diabetes obviously is the most common cause of neuropathy. Hormone problems, autoimmune disease. And we also have neurological imbalances. Okay, we have nerve issues, the nerves being damaged, it's affecting our brain, things like that. So your chronic illnesses, again, peripheral neuropathy, one of them, a combination of neurological problems and metabolic problems that require proper evaluation and treatment. And something you may not have had to this time, or you might not be watching this video. Now, when we're talking about metabolism, it's very simple. Okay, we need to eat food, proper food, and it needs to be turned into energy. Okay. Now, question. 30% of that energy that our body uses, where does it go? What system does it go to? Endocrine system, our glands, digestive system, nervous system, immune system, or cardiovascular system? What do you think? Okay. Answer is our nervous system. So your brain, your nerves, uses 30% of all the food that we eat that gets turned into energy, 30% of it goes to our nervous system, and all the oxygen that we breathe. Okay, so we need to have proper metabolism so we're getting energy so we can have a well-functioning brain and nerves. Okay, these metabolic problems are typically what causes the neuropathy. Okay, what are the leading causes of peripheral neuropathy? Statin drugs, cholesterol-lowering drugs, simvastatin, Lipitor, you know all the different cholesterol drugs. Okay, that's one of the leading causes. Damage to your back, your lower back. If you have things like stenosis, bulging discs, if you've had that for a long period of time, puts a lot of pressure on the nerves in your back and cause damage that you'll feel into your feet and your legs. Diabetes, obviously, or insulin resistance. Chronic inflammation from any type of condition. Food sensitivities. Insulin problems, hormones, and last but not least, chemotherapy. If patients have had chemotherapy, that's obviously toxic to the nerves. The nerves are very sensitive to those toxins. Now, number one, statin drugs. Very common. A lot of people are on these medications, probably many of you watching this. Statins inhibit the formation of cholesterol. That's what they're for. Cholesterol, unfortunately though, makes up the sheath that surrounds the nerve. So the nerve's like a sword. Okay? And there's a sheath that surrounds it, and that's made up of cholesterol. So statin drugs also inhibit the formation of something called CoQ10. You've probably heard of this, supplementation and things. So CoQ10 is necessary for nerve function. So the cholesterol makes up the sheath of the nerve. The CoQ10 is vital for the health of the nerve. So if we're inhibiting both of those, we're going to end up with some nerve damage over time. Statin drugs are one of the leading causes of peripheral neuropathy. They're so widely prescribed. Now again, this is a study from the Neurology Journal. This is from May of 2002. This is quite some time ago. This is not new information. That says that statin drugs, cholesterol drugs, can increase the risk of peripheral neuropathy by 16 times. That's 1,600% higher risk of increased peripheral neuropathy if you're on these drugs for longer periods of time. It's pretty big. Now, why are we taking all these drugs anyway? Is cholesterol really the problem? These drugs get prescribed like crazy. Why has heart disease been going up in our country since statins have been on the market? I mean, statins have been around a long time. If they're supposed to help lower cholesterol and help lower heart disease, why is it going up? Why do countries with chronically high cholesterol, so you have some nationalities, the Eskimo natives, the Orientals, a lot of different Oriental countries, they eat high cholesterol diets, eat a lot of fatty fishes and things like that. Why do they have lower heart disease? They're eating all this cholesterol. Why do they have lower heart disease? Why do just as many people with low cholesterol die from heart attacks as people with high cholesterol? Okay, is cholesterol really the enemy here? We're taking all these medications and they're causing other problems. Take home message. Cholesterol is not going to be what clogs your arteries unless you have some kind of chronic inflammation going on. The inflammation is the culprit, not the cholesterol. You need cholesterol for proper nerve and brain function. It's huge for the nervous system. It uses a lot of cholesterol to surround neurons and nerves and protect them and conduct messages and things. And we're just talking about the brain and the nervous system here. Cholesterol makes up a lot of hormones, estrogen, progesterone, testosterone, adrenal hormones. They need cholesterol. They're made from cholesterol. Okay, if you have damage to your lower back, number 2, stenosis, degenerative discs, bulging discs. Again, very common cause, or it may be one of the causes. We may have a couple different things causing the neuropathy, but this is a big one. Okay, one thing in common. So down in the lower spine, we're getting compression to the nerves, and these are the nerves that go down your legs into your feet. And if that's chronic, it's been happening over a long period of time, you're going to get damage to these nerves. Okay, we do things like spinal decompression, non-surgical spinal decompression, one of the many weapons in our arsenal that we use for peripheral neuropathy treatment. Diabetes and insulin resistance, another big cause. Okay, the nerves need energy. They need fuel. We just talked about 30% of it goes to the nervous system. Glucose is or blood sugar is what the nerve uses for energy. Okay, insulin is the hormone that gets the glucose into the cell. Okay, so that's why insulin is important, obviously. When you're diabetic or you're insulin resistant, the glucose cannot get into the nerve cell. Okay, so we can't get the energy to the nerve that it needs. So the nerves are going to get fatigued and they're going to die off over time. We're going to get numbness and burning and weakness. We're going to get all the symptoms. Chronic inflammation, another big cause, some kind of inflammatory process. Okay, you cannot, and it's crucial to figuring out what's going on with patients, because if patients have this going on and we don't address it, we can't fix the nerves. We can't rebuild the house while it's on fire. Common causes of inflammation, these inflammatory processes. Food sensitivities, inflammatory foods. Someone might be sensitive to a food they're eating. Infections, hidden infections. Poor fatty acids. Everyone talks about the fish oils, the omega-3s. Patients don't have those in proper ratios, can cause damage. High insulin, hormone problems. Okay, these metabolic causes need to be addressed if we're going to win the battle. If we're going to help get your neuropathy better, we have to figure these things out. So what do we need to do? Comprehensive blood work. You probably haven't had enough done yet. We need to do everything. Okay, you've probably been told, even if you've had some blood work, you're normal. You're not diabetic, those kind of things. Lab ranges, we need to consider this, are very broad and can be inaccurate. Okay, they use bell curves, so you have to be half dead sometimes to fall outside of these ranges. Okay, we want to use functional values. Okay, we want to pick up on these problems before they become pathological. Okay, so we want to pick up on things in here, these functional ranges. This is typically while you're told your labs are normal, but you still have this neuropathy. Well, what's causing it? You could be, when you're low, you'll be out here. When you're high, you'll be out here. That's when your doc will say, okay, well, your blood sugar's too high, now you're diabetic. Take these medications. What we want to pick up is on things that are in here and in these yellow areas, because we're going to be able to find them sooner and be able to fix them sooner. And you may never get to these areas. You may hang out here in the middle forever and suffer. So were all your tests normal? Okay, let's start with the glucose. That's the big one. Okay, a functional range we want to see you is between 85 and 100. That's normal. Okay, traditionally, what's going to show up on a lab test? Between 65 and 110. So you have to be below 65 to be considered hypoglycemic. You have to be above 110 for any doc to consider doing anything. Okay, so what if you hang out in that 105 region for a while? Right? It's higher than 100. My blood sugar is slightly elevated, but I'm not diabetic. Okay, well that still could be damaging my nerves over a long period of time. Now, what happens when your brain, you can't feel your feet, right? Because they're numb, they're tingling. What happens to your brain? It's going to affect your brain eventually, right? Okay. There's a study about peripheral neuropathy and the changes it makes to your brain. So patients with peripheral neuropathy were studied, and they obviously saw things like loss of balance, but we also saw things like increased memory loss, depression, anxiety, dementia, insomnia. So after a while, these problems in the periphery are going to affect your brain. They're going to affect your central nervous system. We have this map in our brain. It's called the Somatotopic Map. And basically, it's your brain's representation of your body. So your brain, there's a spot on your brain that represents, your big toe on your right foot. We could shock that part of your brain and your right toe would move. Okay? Or you would feel pain in your right toe if we're hitting that part of your brain. So again, if we can't feel our feet for long periods of time, that part of our brain is going to lose the representation. It's going to almost forget about the foot because it's not getting any input from there. So what do nerves, our neurons, need to survive? How do we get them better? How do we get them well, and how do we rehabilitate them? Two things. We need fuel. Okay, we talk again that 30% thing. We need good nutrition, glucose, sugar in proper levels. We need oxygen to these nerves. We need to decrease any inflammation to these nerves. Good, healthy fuel. And we need activation. These nerves are dying off. They need to be healed and they need to be re-stimulated. They need to be fired up again so they can start shooting those messages again back to the brain. Then your symptoms will go away. Activation. We use a bunch of different things to activate these nerves. We use some specific treatment protocols in the office and at home. Peripheral neuropathy relief therapy. We use, what it does is it stimulates the nerve electrically. It's specialized. It helps to block the pain, helps to improve blood flow to the nerves. Okay. Also stimulates the nerve biochemically. Okay, so it allows for greater metabolism and healing. Reduces inflammation locally at the nerves. Okay, so we need to re-stimulate these nerves. We have specific therapies that we use to do that. What else do we use? We use a class 3, a low-level laser. It's called a cold laser. Okay, what does the cold laser do? How does that help? It's a specific wavelength of light that's been proven over time. Go into the nerve cells, stimulate energy production inside the nerve to allow it to heal. Okay? It also stimulates the microcirculation so we can get improved blood flow to the nerve, and lymphatic drainage, drain all the gunk out of there. Again, the light has to be coherent, meaning that it doesn't scatter. When you shine a light on someone, we don't want the light to scatter. It needs to stay in a beam. Something like anodyne therapy, which patients may have had, you may have heard of this or had it, non-coherent. Not nearly as effective because that light doesn't get to where it needs to go to help heal the tissue. It's not laser therapy. Okay, so what else needs to be done? We talked about the peripheral nerve rehabilitation therapy, the cold laser therapy. We do things like oxygen therapy. We need to get oxygen to these nerves. And we use certain stimulations like vibration. So vibration stimulates the large sensory nerves. So we get some oxygen to those nerves and re-stimulate them with various modalities, vibration being one of them. What else do? We do something called rebuilder therapy. Again, it's a specialized treatment for peripheral neuropathy that we'll have patients do at home a lot of times. Again, done daily at home. We do it in the office also. So we're talking about now fixing the nerves with therapy, helping to heal them. We need to do some other things too, right? We need to address those metabolic causes. Things like fatty acid supplements and different supplements. If patients having trouble with their blood sugar, we got to get it in check. Those kind of things. So we need to look at all these different hidden causes and then fix the damage. Okay, we have to address what's causing the problem, whether that be something metabolic or neurological, and then heal up the damage. That's what's going to help get you better. A couple key points. It takes many different treatments to help correct the problem. Again, there could be many different causes. We ran through a whole bunch of them. Not just one thing's going to do it. There's no magic pill. Okay? Have to address the underlying metabolic causes and the neurological causes in order to have success. It's progressive. It's a progressive condition. So if you let it go, it's going to get worse over time. And there may be a point where there's no coming back, but even the things that we do can't help. So our peripheral neuropathy program is the most comprehensive state-of-the-art one that's in the area. I mean, we've been doing this for a long time, put a lot of work and effort, a lot of study into helping patients like yourself. So in summary, we need to do comprehensive blood work on our patients. Okay, we have to look at these functional ranges and look at the underlying metabolic causes that could be contributing. We typically need to change patients' diets. If they're sensitive to foods or we need to decrease inflammation, that diet's the easiest and quickest way to do it. And then we need peripheral neuropathy. We have to heal the nerves and activate them, stimulate them, doing things like spinal decompression if there's problems in the lower spine, the peripheral nerve rehabilitation therapy, cold laser therapy, supplementation, oxygen therapy, those kind of things. So, how bad are you? This is what we're going to have to figure out when patients come in and give you the opportunity to do so. Initial exam or consultation, we do a complete neurological exam. We do something called the Toronto exam. It's specific for peripheral neuropathy. Okay, we can do various procedures. We score it. A normal score is 74. We got to figure out what you are. We got to figure it out. That's going to show us how severe the problem is. So what's next? If you like what you're hearing today, you can come in and set an appointment. We sit down, we have a consultation, it's at no charge, and we'll figure it out. Figure out what's the problem. What is causing the problem? Can we help? Okay? Our phone number, I'll give it to you again later, 610-974-9911. Okay? What's going to happen? We do 2 visits. First visit, we're going to do a complete review, case history, neurological exam. Review your previous treatments, review your previous labs, those kind of things. Fill out some assessment forms. Spouse or significant other should be here with you. It's important. If it's important to them, it's important to you, it's important to us. We all got to be pulling on the same rope here. After we do a case review, if we can help you and we accept your case, there'll be an overview, then we'll kind of lay out the plan. Okay, what do we have to do? Testing that might need to be done, treatments that need to be done, any finances. You know, again, good to have your spouse or significant other here. Okay. We only take a handful of patients every month for peripheral neuropathy. A handful, 5. First 2 visits, usually, you know, what I charge for those 2 visits is, you know, $450. If we make an appointment after attending a workshop, which we do, we're watching this video, we do that for $37. Just gives you a chance, just for a few minutes of my time, so that we can look and see if we can help you. Now, there's 3 rules for us to accept your case. This is on the patient. Have to be willing to make some life changes. There's probably going to be some changes that need to be made. You're going to have to come in for therapy. We may be asking you to do some dietary changes, things like that. Get better control of your diabetes, things like that. You have to take accountability for your health. I can't do it for you. I can't want it more than you do. Neither can your government or your family, or it's got to be you. You have to take responsibility for your health. There's a good chance insurance and or Medicare might only pay a small portion of the treatment that you might need. It might not pay any at all. We have made our care plans affordable so that a large percentage, 96% of the people who see us, can get the care that they need and the care that they want. And if there are out-of-pocket expenses, it can be affordable. Okay, small monthly payments even. Okay, 6 things to think about. Okay, scale 1 to 10. How serious is this? How long has this been going on for? Okay, what's going to happen in 3 years if we don't get this thing fixed? What are the 3 things that you could do right now if you didn't have this neuropathy? I could get back to my walks. I could get back to playing golf, things like that. Okay, how serious are you? You know, there are time constraints. We only want the patients who are the most committed. I want to thank you for your time. I know we got a lot into a short period of time today. Again, if you have questions following this presentation, email benedettochiropractic@gmail.com. I'll gladly answer any questions you may have. You can call us, 610-974-9911. Again, I'll help you any way we can, answer any questions you have. Email benedettochiropractic@gmail.com, 610-974-9911. Thanks for listening. Let us know if you have any questions. Have a great day.